Thank you. Jazakallah. Thank you for your attention. We'll start with our presentation on health matters. And the topic for discussion this year is going to be high risk of heart disease among South Asians. Before I go further, I would like to introduce and thank our panel. On my right, on my extreme left side is Dr. Khalid Mahna Sahib. He's from Florida. He's an intervention cardiologist. Then Dr. Mansoor Qureshi Sahib, he's also an intervention cardiologist in Michigan. And then Dr. Mubashir Mumtaz Sahib, he's a cardiac surgeon. With that brief introduction, what this is going to be a very brief presentation from me, and my job is really to just introduce to the topic. And after that, I would like you to come over and then you can ask questions. What I would request is not to engage in any kind of confrontation, dialogues. They are just cardiologists. They're not very educated people. They just know a few things about your heart. So if you have any secret cures or anything, you can share with them in private, but don't harass them here. I'm the person to be harassed.
Assalamu alaikum. This health talk is going to be very, very important, very informative, and very educating. So I'll request everybody to please listen to whatever is being presented. Please don't talk to each other. Otherwise, the people who are interested in listening to this conversation, they'll be disturbed. Please listen to the discussion. If you want to talk to somebody, please step outside. Jazakumullah.
Jazakumullah. The reason we picked up this topic, I hope everybody can see this. Basically, Southeast Asians, they have been identified as a unique group that suffer from heart problems. How bad is it? You can actually see on the slide that a large percentage of Southeast Asians, which includes Pakistanis, Indians, Bangladesh, those countries, they are at an extremely high risk of not just suffering from heart disease, but also from dying at a very young age. This includes men, women, and then if you can read all the slides, you can see how deadly it is. Not only these people suffer from heart attack at a young age, but they also die from very much deadlier heart attacks at a very young age. And then this study, if those of you who are interested, it was done by an Indian physician, I believe, in University of Southern California. It's called Masala study. So it's not really the masala, but it's mortality associated in this group. And there are some of the reasons that we found. One of the top reasons that is identified is your smoking and diet. Look at the food. Do you identify any of this food in this langar khana? We had nothing to do with it. This is all the Ijtema people. The big problem is many South Asians still continue to smoke. That including, unfortunately, even Ahmadis. Not as bad as used to be, but they're now more of a closet smoker. They don't smoke, they go outside or they hide behind your tents after they finish eating. But there's still a big chunk of people who eat and smoke. The other common risk factors, that's called pre-diabetes. These people are not diabetic, but their sugars are running in that area where they're likely to become diabetic in the next 5 years or so. Their sugars are right edging, and a lot of people will call, I'm borderline diabetic, I'm not a diabetic yet. All of these risk factors, smoking, diet, diabetes, will push you towards having a heart problem. The other problem is the thin fat syndrome. South Asians, we are not big, muscular, tall race, but we have little bellies. And this little belly is a very active organ. It contains fat. This is just not silently sitting there. It's an active organ, and this is considered a unique risk factor also for cardiac problems. Our cardiologist will answer that for you. So when you add up all of this together, which is the metabolic syndrome, your pressure is high, your cholesterol is high, your sugar is a little bit high, all of this adds up. It doesn't happen overnight, but over periods of months and years, these numbers will contribute toward developing heart diseases, which would be angina or having a full-blown heart attack, or God forbid, even sudden death. These are the risk factors. Now, many times patients will come to us and say, oh, I have no symptoms, I feel fine. And that's where the problem is. Because when you feel fine, but your numbers are not fine. What can you do about it? I mean, these are simple risk factors, whether it's khana or exercise or lack of exercise, smoking, your pressure, your cholesterol, etc. These are the things that you can change. This includes your nutrition, your exercise, or not being active, medications that can treat you, etc. All of those risk factors can be modified, most of them at least. You know, if you have a strong family history, that's another issue. You can't change your age or sex, unfortunately, but the other factors are very modifiable. With this brief introduction, there are options that you can take. What I would like to do is if you can please line up those who are interested to have any questions. And if there are no questions, I would like our cardiologist panel to start talking about, particular risk factors and what can be done about it. Okay. So if you have any questions, comments, please come to the mic. Our panel will be here to answer questions that you have. Okay. Questions? If anybody is interested, please come to the stage. And I just have to gently remind, please do not argue with our panel. They're just cardiologists. They're not very educated people. Please don't confront them. Carry on.
Assalamu alaikum warahmatullah. Can you please define a little bit what cholesterol is and how does it affect your heart, if you can define that?
Cholesterol, the question was, can you explain what cholesterol is and how does it affect the heart? So cholesterol is one of the ingredients, very essential ingredients of our food that we eat. Like we have carbohydrates, proteins, and fats. Cholesterol is one of the fats, and it's an important part of the structure of our body. हमारे जिस्म में cholesterol का बहुत अहम role है. It's very important. But as we know, and by the way, I think all three of us will be focusing this based on the guidance we receive from the Holy Quran. So everything is in moderation is important. So whenever there is excess of cholesterol in the body, it can cause problems. To give you an example, just to explain is, consider a pipe that you have, a drain pipe in your homes, and sometimes they get clogged. So cholesterol causes blockage or clogging of those arteries. I'm telling you in a very basic fashion, and that can, with the blockage, there is decreased flow of blood, and the heart can suffer because of that. We can have symptoms of chest pain or angina, or eventually we can have heart attack. But not only heart, it can affect the brain and other arteries of the body. So cholesterol is important, it's essential, it should be in the diet, but excess causes problems.
Dr. Sahab, if I could ask to clarify. So, we frequently hear, don't eat any kind of fat or any oil. Do we have to go to that extreme, so you should absolutely ban from any kind of, or is there anything like a healthy fat or versus a bad fat? If you could please say a couple things on that.
Ji, Assalamu alaikum. As Mansoor Bhai has mentioned, the balanced diet, and I'll come to your question about cholesterol, for example. We start, as Mansoor Bhai mentioned, that there are three types of foods: proteins, carbohydrates, and cholesterol, or fat, or lipids. So all these three foods are somehow in our body. Body is a very smart organ. It differentiates it well, and it can convert one to the other as on the need basis. And that is where the importance of fasting comes. So for example, yes, we say fat or cholesterol, do not consume too much fatty food. But at the same time, for example, South Asians, and that is our topic, why the cardiac disease is so prevalent in South Asians is that because we are basically India, Pakistan, Bangladesh, we are a agricultural part of the world. The food was abundant, and God has blessed this region with so many types of foods. And that food, for example, wheat, rice, and sugar, that is the basic food. For example, in Punjab, we call our food, we don't call it food, we call it roti. Chalo roti khaiye, let's eat roti. So that's how much important this roti is for us. And that, in a way, is a bad thing for us because our forefathers, for example, they were working in the fields. Since from early dawn to the daytime, they would plow and they would do different chores on the fields. But when we now living in this modern world, especially moving to this country where we even go to our groceries on cars, we don't even walk, that same roti is converted into triglycerides, and that's the fat. And that triglycerides sit in our coronary arteries or the arteries of the other part of the heart. And that's how it causes the narrowing and then eventually the heart attacks. So this is where we have to be smart about what type of food we are consuming. We have to be very careful. For example, most of us, if we just did now our fat or lipid profile, our triglycerides, most of us will have very high. And that is because the food that we eat here and at homes. And that's where we have to be smart and consume the food, as Mansoor Bhai said, khairul umuri awsatuha. So the best way is the moderate way, the middle way. You eat every food, but in moderation. But if you have certain disease, then you talk to your physician, and we can individualize your diet. So on general basis, khairul umuri awsatuha.
Jazakallah. Next question, please.
Assalamu alaikum. Maybe the reason was our food. I was wondering if stress has any role in these diseases that you had mentioned.
So, stress has a significant role. Maybe not directly in formation of the plaque as such, although it can, but it can lead to some of the other risk factors that lead to problems. For example, incidence of blood pressure. And then if the pressure is too high, then the kidneys can get involved, the heart muscle can get involved, the brain can suffer. So indirectly, stress can raise our heart rate, it can raise our blood pressure. And again, interestingly, as I said, we will keep alluding to, we're told to go for salat 5 times. So we are told to break what we're doing, do our wuzu and do salat to try and break that stress cycle also. So that's helpful. So stress has a role, but an indirect role in cardiovascular disease in general.
Dr. Sahab, I think, I think he wants to, does stress affect Asians any different than it does affect Africans or Americans, or is it the same for all people?
I think it involves everybody. Our problem is more genetic. As such, our make is different, our artery sizes are different, the fats is different, but stress affects everybody, right?
So it's not unique. So that's a collective stressor as an American that you will suffer. So it's not unique that Pakistani, I think if anything, we can suffer less by Dr. Saab, as you said, offer namaz. Next question, please.
Jazakumullah. Can I ask one simple add-on question? These days, they say the ghee or desi ghee is in. So many people here, they love desi ghee, but they had to leave it and, move forward. And now it seems like it's becoming a fad in this country. Is it true or not?
I think Dr. Bashir Sahib is very quiet. Let me see what he has to about desi ghee. He's a cardiothoracic surgeon, by the way, mashallah.
I think that the smart people before me mentioned that everything in moderation, and that's what we learned from the example of Holy Prophet Sallallahu Alaihi Wasallam. So you can eat anything, but everything is moderation. And I mean, personally, I see that the days that I'm able to do the salats on time rather than days that I have to combine them, or I'm busy doing other things, and I'm able to eat sort of a balanced sort of food, which means I'm not overeating, you yourself will know that you're feeling better. And that satisfaction and sort of sukoon, it's called in Urdu, that you get in your body, you also feel closer to God Almighty. So whatever you put in your body affects your emotions. You talked about stress. Stress releases a lot of hormones in the body. And some of those hormones can put body in a situation where it will start storing food. I was just talking to my good friend, Dr. Abdul Qaddus, who's a specialist on that topic as well. And he was telling me that if you exercise too much, exercise is good, but if you exercise too much, then it will release certain hormones that will make your body reserve more fat, because the body wants to prepare for those stressful situations. So it's not just mental stress, it's also physical stress that matters. So simple rule of thumb is, and this is what Huzur has given advice to Murabbiyan and other people who have met him on personal mulaqat, to do at least 20 minutes of rigorous activity every day, hopefully at least 5 times a week. So some sorts of 20 minutes is something, and there's a hikmat and wisdom in it, and I've heard this directly from Huzur as well. The hikmat is that when you say 20 minutes, it does not sound too stressful to be physically active for 20 minutes every day. Not asking you to go to gym and work out for an hour, but at least 20 minutes of rigorous activity, and then eat sort of a balanced diet. And what's the balanced diet? Holy Prophet ﷺ has talked about that if there are 4 portions in your stomach, you fill 3 of them, so you leave 1 portion empty. So those are the few key things that all of us struggle. I know I struggle with that sometimes, but if we continue to try to achieve that, hopefully someday we'll get there.
Dr. Saab, what would be an simple example of a 20-minute stressful exercise? Somebody who's not used to it, what would be a simple example?
Yes, simple example, rigorous exercise is whatever activity, whether you are walking fast or you are on a bicycle. One of the people I know, Hazrat Saab mentioned to them that you can do stationary bicycle in your basement because that person did not have time to go to gym or run outside. So rigorous activity means if you're walking fast or if you're in a bicycle, your breathing is fast enough that you're not able to carry out a tune for singing. A nazam that you sing normally otherwise, you will not be able to sing it or to carry a tune of that nazam. This is a very simple way of figuring out what rigorous activity is. And then you can feel your heart rate, you can feel your breathing going faster. So just walking alone is not going to help you. You have to do fast walking, so your breathing is fast enough that you're not able to carry a conversation or carry a tune if you were singing at the time.
Some people should not sing irrespective.
You know, we gave a very long answer to a short question, but going back to the desi ghee, be careful. It's not that good.
At least we did not endorse it.
Next question.
Yes, Assalamu alaikum. I have 2.
आप भी बता दें अपना.
I am Mahmood Ahmed from Georgia.
जी.
If you allow me to ask 2 questions, please.
जी, please continue.
First one is, I have heard that the fasting sugar level around 100 is considered pre-diabetic. That's what my doctor says. Is called pre-diabetic, then you need to be careful. Also, I am using these days this one gadget, small machine provided by the company where I work. That you can use your own Live and Go, I think that's the name of that. When I get that fasting sugar level 110, 115, and I do get once a while, it tells me you are doing great, you are doing fine, keep doing it. So could you comment on that, please?
So yeah, I think if you can look at the slide, the levels that are commonly used may be too high for us, Southeast Asians. So if sometimes we use fasting, sometimes we use what we call hemoglobin A1C. A lot of you may have heard of that. The numbers that are mentioned here also, is it in this slide or another slide? So 100 may be a little too high, and it's called pre-diabetes, that we have not been officially diagnosed as diabetes, but we are at risk. In fact, most of us are at risk for developing diabetes because of where we come from. And some of those numbers saying it's okay is for diabetics. So if a diabetic has a 110 or 115, the machine will say you're doing great. But for a non-diabetic, 110 and 15 is abnormal, markedly abnormal. Not in the diabetic range, but it's abnormal.
So that machine you're using is for diabetics. For a diabetic, that number is fantastic. But if you're not a diabetic, 126 is the cutoff. At 126, you are considered a diabetic. So what it is telling you to stop. Don't keep going in the same trend. That's what it means.
Jazakallah. Second question is the effect of age and altitude. Like if you are living at a higher altitude or you are going up on a mountain, how does that impact this age group, the Ansars versus Khuddam, if you are at a higher altitude, cardiovascular arena, the age factor, and higher altitude, please?
So that is not unique to us. That is to anybody. At higher altitudes, the pressure, the oxygen levels go down. When you go there and if you exert, that's when one may feel symptoms. So going to a very high altitude, be careful, depending on your history. If you haven't worked out for a long time and you go to Atlanta and start running, you will feel it right away. So, and because of that, there's added stress. Blood pressure, heart rate will go up, oxygen level would be low, and you may feel the stress. So be careful going up and coming down if you have lived at a high altitude for a while. You want to add?
That's exactly right. So higher altitude means the body and the heart has to work harder to provide oxygen to your muscles. Why? Because the air is thinner at the higher altitude. So less amount of oxygen. That's why when climbers go to Mount Everest, they have to carry oxygen tanks with them. The air is so thin that high up that they cannot breathe that air. So above a certain height, and I don't recall exactly what altitude, but above a certain height, the air really becomes thin, and then that puts a lot of pressure. So the terminology that's used is called acclimatization for climbers, that they have to go up sort of slowly. That's why people who climb Mount Everest, they go to these base camps first, build up their oxygen level, train their cardiovascular system, and then when they're coming down, they do the same thing. So obviously, as you get older, and if you have blockages in the arteries of the heart, which are not that significant, they're moderate, and at sea level, they're not causing you any problem, yes, with the increased stress, they might cause more issues for you as you climb higher.
Thank you, Jazakallah.
Assalamu alaikum. I'm Professor Amir Hussain from Brooklyn.
Can you come a little closer? Can you speak a little closer in the mic?
Okay, I have two simple questions. One is that recently in some Western countries, including USA, researches are conducted on the effect of meditation and prayer on health, and also on your field, cardiovascular. And it has been found that there is a positive relationship between this prayer and meditation and the positive effect on health. So, as a cardiologist, what is your observation? Have you gone through some of the research findings published in medical journals? This is number one question.
Hold on. Let's do the first question.
Okay.
Did you understand the question?
So you're talking about the effect of prayer.
Prayer and meditation.
Meditation, prayer. Absolutely, no question about it. I think Dr. Saab said, Allah bi zikrillahi tatmainul qulub, right?
Yeah.
It's a verse for cardiologists. So heart, mind, body, soul, all of this is an impact, and there are studies available that, for example, those who are spiritual in some sense, I'm not going into the religious debate, but you have some faith based after a heart attack, for instance, their recovery is faster. And I already mentioned that earlier about breaks, and also wuzu, putting cold or water on your face and hands. There is hydrotherapy, we have heard of that. So all of that, getting up early in the morning, doing wuzu, offering salat, that is the time where heart attacks happen the most. And so religion, it doesn't have to be Islam, but faith has an impact. And we have obviously been taught about all of this already a while ago. So definitely, yes.
Yeah, then my second question is on yoga practices. Mm-hmm. You know that Khalifatul Masih Rabi in his famous book, Rationality and Revelation, also mentioned of yoga as a very good exercise. And the Hindu clubs established in different Western countries, they virtually claim everything from A to Z can be obtained through yoga. So what is your observation on that?
I missed what was the question?
So your question is about yoga. So he is saying that whether or not, are you talking about the benefits of yoga or on heart? So it's
So yoga
unique
is also
benefit.
considered a form of meditation, and that's what the impact is, and that's what the effect is. And that's what Mansoor Bhai mentioned earlier about the stress when the question was asked. So for example, getting up, and I'll make it easy for Sadr Sahib Ansarullah, to all of us who are in this age, above 40, to be regular on tahajjud. As Dr. Saab said, most of the heart attacks, and as intervention cardiologists, we know, because we have to get up around 2 a.m. to 4 a.m. to take care of those patients who come with the heart attacks. And that is the time that is for tahajjud. And for some, there are studies that the adrenaline level, if people who do endocrinology, the adrenaline level is high at that time. So when we get up and we do the ablution, we break that cycle. We put water on our face and then do the massa of our neck. And a lot of people actually, they say that there is some effect on strokes, that if you do massa, this has some prevention. Obviously, I cannot prove it, but being an Ahmadi Muslim, I can just say that I'll take it as a blessing. So this is where we have to understand the benefits of our health rituals and apply them in our daily rituals and use them for our benefit.
Physicians or surgeons, we don't have a magic pill or a magic food. I mean, in our culture, they say drinking wine, a glass of wine every day prevents heart disease. It's not the alcohol in the wine, it's the chemical in the grape juice that has been shown to be preventative. But there's no one single thing that you can do to prevent heart disease and to stay healthy. So you have to do a combination of things. So meditation, eating properly, exercising every day. My good friend Khalid Manasab mentioned that in Pakistan we eat diet that the farmers used to eat. But we're not working like farmers anymore. We are in a Western country where we don't walk much every day, but we're having a diet that an active farmer in Pakistan used to eat. This halwa puri and stuff, that means we should be working in the fields for 8 to 12 hours. None of us will be doing that today. So we have to understand we're in a different environment. And there are bad things about diet in the US as well. There's a lot of chemicals that we are ingesting. You can watch any program on YouTube or Google about diet and stuff. Different meats, the way they are produced, the poultry. Again, what it comes down to is that you cannot avoid eating, you cannot say, I'm going to leave this food. God Almighty has made it for our consumption. But again, what it comes down to is eating a balanced sort of diet. You can eat everything, but small amount, but stay physically active and spiritually active. They both go hand in hand. Why? Because spiritual activeness gives you that discipline that you need to stay physically active. Otherwise, you'll be physically active for a month, 2 months, and then just like anything else, we fall into this laziness that we will not be doing it. If you're spiritually active as well, then the mental satisfaction is both ways, and hopefully we'll be able to carry it for a longer period of time.
So just to summarize, yoga is a unique, set of exercises being present in certain cultures of thousands of years. So is Tai Chi. It has some unique benefits. It's a slow-paced. It improves your muscle tone, relaxes you, increases in stress, etc. So, and in science, we have a sense of fairness and balance. We're not saying this is the only way and that's not the only way. That's what he's referring to. So it's a unique set of balance that you have with activity based on your age. If you start climbing mountains in your 60s when you have never done it, that's not a good idea.
What happens, sorry, if I can add, Dr.
G, please.
So exercise also, or any activity that you like, will release certain hormones. They are called endorphins in the body. And they have a calming effect anyways. So we can't just say that we like, we practice Salat, maybe the best form, but it's not an exercise, by the way. If that's the only exercise we're doing, then we're probably not doing a good job. So physical activity or the activities we like to do has an impact as well. So some may like yoga, some may like running. Like, for example, the 5K run this morning, they probably enjoyed it a lot.
And breakfast. Next, please.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Come closer, please. Come closer.
Muhammad Afzal Irani from New Jersey. So I have had twice heart attacks. I'm well over 83, and I learned something which I wish to describe, that after that, it was a lesson for me that I have been lazy about not been well looking after myself, which is a must in Islam. So I am glad that our doctors have, the first time, I have heard all the quotations from Quran. Actually, Quran Majid describes everything. And the life of Hazrat Rasul Akram Sallallahu Alaihi Wasallam and Hazrat Masih Maud Wasallam have not been mentioned yet. Hazrat Masih Maud was a good wrestler, and he used to use mogas for exercise.
Ji. What's your question? I'm sorry to interrupt. What's your question?
Well, that's the life. Question is about heart. I had twice heart attack, but now, last month I have been checked, and the doctor has, Ahmadi doctor, he has taken video of whatever the facilities are now. And he has shown me my heart working better than a young man.
Alhamdulillah.
So that's what I am telling you, the practical things, not the theories. I am not a physician that I should take. But Hazrat Masih Maud Wasallam is the exemplar, and he is the person who is example for us. He used to walk regularly, and he used to exercise. That's what I am telling. I'm not a physician. But I think the prophets or the prophets of the time are the practical example of us.
That's what they were saying.
Well, that's they were saying. I'm just doing it. I'm not
Jazakallah.
Jazakallah for your comment, and we agree 100% what you're saying, and that the key for exercise is not, earlier we discussed, and I'll just add that it's not the time or how long or how much or how strenuous exercise you do. The key is the persistence and regularity, and the word you use regularly. Promise I used to do it regularly. That's where the key is. You do 10 minutes, do it regularly. You do 15 minutes, do it regularly, and that's where you get the benefit. Jazakallah.
Next question, please.
Assalamu alaikum wa rahmatullah. Ataur Rahim Hamid from York, Harrisburg. I have a question about cholesterol. You know, a lot of patients take medicines for cholesterol, but sometimes it does not affect that way it should affect, because doctor will say this is genetic. So I want to ask you if there is any prevention with which we can stop this genetic cholesterol so that it comes under control. Thank you.
Was the question, how can we avoid taking the medications?
No. Even with medication, if it comes under control, is okay. And what about other preventions? Are certain foods you can use which can control this genetic cholesterol?
Okay. So 2 quick points. I think we talked about this already, and that is both the diet and activity. Animal fat is one that raises cholesterol if we restrict it, again in moderation, or restrict depending on our situation. When we're saying moderation, we don't want to leave it subjective. That you're going to say, well, you know, for me moderation is, you know, I don't know, a heap plate. But it's moderation means smaller quantities, not too much. But animal fat is what raises cholesterol. Trans fats, as we call it, the fats that are used to fry, you know, French fries or the fast foods and the fried chickens, those are the trans fats. Those are also bad. Fat that comes with meat, that's also animal fat. That's not good. But lean meats, chicken, fish especially, fish is very, very beneficial. At least once or twice a week it is recommended. So we obviously don't eat pork, but that's called, you know, lean fat also. If you want to have beef, it should be lean, but don't eat beef a lot if you're having cholesterol problems. And then if we do eat some of that, the activity has to come with it, because we have to burn the calories to not let the fat deposit. One thing I should mention here, that there's a lot of, by the way, Google was mentioned earlier. Be careful with Google also. Google can misguide us a lot. And I see people all the time, all of us do, and there are a lot of physicians sitting here that we see people who come in who think they're going to die tomorrow because of what they read in Google about their symptoms. Plus, there's a lot of misinformation, especially against the medication about cholesterol. There are two, and others can correct me, in cardiovascular, especially heart-related, there are two very important medications that save lives. Two, and one is aspirin that is simple, and the other is statins, cholesterol medications. So people talk a lot about some side effects, muscle aches and things like that, but they don't talk about the life saves at the end of the day. So don't be afraid of taking them if the doctor has prescribed you.
I'm taking regularly. Thank you very much.
So, Dr. Khalid Mirza Sahib, I just want to ask you, how many times a week a person should eat? So we have 21 meals in a week. How many times should meat be a part of your diet? Simply, meat of any kind.
I mean, it depends. If your LDL number is one of the cholesterols that is measured, if that is high, I would not eat meat regularly. I would eat once a month maybe. But if we are talking about South Asians, so what I want to add here to Mansoor Bhai's point, very important points that he made, is I think we all have to go after those triglycerides, and that's where our problem is. And I'll mention two examples of two diets and what I am seeing in my practice. The triglycerides, and Mubashir Bhai will also add to this, is that the South Asians, when we do cardioangiograms, we see the sizes of the coronary arteries are much smaller in South Asians and all of us as compared to Caucasians or even African Americans. And that has to do with some genetic predisposition and some of the other confounding factors, and one of them is our diet. And our diet is rich in carbohydrates, as I mentioned, so we have to be very careful how much roti we eat, how much chawal we eat, and how much chini we eat. These three foods you have to go after and portion yourself and be more very strict with consuming these three foods. And this example I would like to compare with another group of people. For example, I'm in South Florida, and we have a lot of island population, and one of them is Haitian people from Haiti. If, for example, in the hospital where I work at, the surroundings are from a lot of Haitian patients. So if I did cardiac cath on 100 patients, only hardly one or two will have coronary disease. They will not have coronary disease. They do not have coronary problems. Their coronary arteries are clean. 92-year-old, 82-year-old, I mean, octogenarian population, and their coronary arteries as clean as, for example, a teenager's coronary arteries. But they have another problem, and that has to do with the food that they eat. And because Haiti is a country where they don't have food, they don't have natural resources, so they have to preserve food, and the best preservant for food is salt. So they put, over a century's period of time, they have learned to preserve food, and they add too much salt into their food, and they have hypertension that I've never seen in my life before. Somebody would be walking in the emergency room, and their blood pressure is 290 over 150, and they're talking to you, and if, for example, if we have that blood pressure, we will be on the floor. Our aorta will be bursted. But they have the complications of that uncontrolled high blood pressure. They have strokes, they have dialysis, they go to dialysis early, and then they have hypertensive heart disease where heart finally gives up and the function of the heart goes down to 5 to 10%, which is normal 55%. So you have to individualize, you have to understand with every single human being what their ethnicity is, what their background is, what kind of problems they had, what their laboratory analyses are, and then we can specifically tell them what kind of food they should be consuming.
So just to translate, the coronary arteries of the heart, right? And जिसको दिल की शरियानें कहते हैं, and hypertension, high blood pressure. बहुत ज़्यादा blood pressure हो जाता है. And Dr. Mubashir.
Next question, please.
Jazakallah.
Assalamu alaikum, Muhammad Akbar Salman from Rochester, New York.
थोड़ा करीब आ जाए.
I have multiple questions.
Start with one first.
You mentioned about the pre-diabetic diagnosis. What is the best age? We know all are over 40. When we should be evaluated for that from the doctor's office?
So once you hit Ansarullah, you should be seeing a physician once a year. It's very
No,
simple.
I'm seeing the physician. The primary physicians are so relaxed. They tell you, oh, we'll do it started after 50. So that's my question.
So,
I'm glad you asked these questions. And you were probably upset, all of you, that science keeps on changing. But that's how science is. the age to start watching and being careful has been lowered significantly. According to American Heart Association, at the age of 20, the first analysis should be performed. Your cholesterol level, sugars, and everything should be checked. And there is a thing called primordial prevention, where even the diet of a young child, because of the type of unfortunate diet that we have around us, that has to be watched. So I'm not going to go into the detail of that, but starting at a very young age, the first analysis should be performed. And the cholesterol and all its effects that we talked about, it starts in teenage, by the way.
Sooner the better.
So it's okay to ask the doctor?
Yes.
Okay, the next question is, how important is the dental hygiene for the heart?
I mean, simple answer is it's very important. I mean, there is correlation between dental disease and heart disease, not only from coronary artery standpoint, but from infection standpoint as well. And it's a big problem that surgeons deal with all the time. People come with their heart valves that are damaged because of infection. So dental hygiene is highly important. What dental hygiene or taking care of your teeth or brushing teeth twice a day does is it allows body not to fight all the bacteria in your mouth all the time. And rather than fighting those bacteria in your mouth, the energy of the body could be used elsewhere. So in the US, we have these facilities available. Majority of the insurances cover, so one should utilize these services for sure.
Every 6 months.
Twice a year, you should have a dental visit for dental cleaning.
Okay. And other question, you know how you go in a market and you already mentioned about aspirin use. You know, they have a little red heart on the bottles. How we evaluate if you are a lay person, just impressed by the heart and pick it up, start using? No. And I know you said that with the doctor recommendation, but there are other things. Vitamin CoQ10 is in the market, and fish oils, omegas, they're making confuse everyone.
I'll make it easy for you. Based on current science, aspirin is only, you know, there are exceptions, but based on current level of evidence, aspirin is only recommended in someone who's already has the problem. So if someone has been diagnosed with heart disease, has had heart attacks, procedures and things, people who have no diagnosis probably shouldn't be taking. I know there are some who may argue with that. As far as all the supplements you're talking about, you will find a lot of pros and cons and everything. The only dietary supplement that has been shown to be beneficial conclusively with the current level of evidence are the fish oils or the omega, all of those.
Assalamu alaikum warahmatullah. Latif Ahmed Tahir from Austin. So there is a lot of pollution at this time. So I want to know what is its effect and how we can prevent from that.
This is not a short question.
Next question.
It's bad.
Assalamu alaikum. What's the root cause for restless leg syndrome and the diagnosis for it?
I'm going to skip that on.
I can just address that on the side. So we'll just ask for a quick summary, Dr. Saab, if you can do for in 2 minutes. All of these doctors and others will be available. If you need time to discuss, come to the basement, please.
So the take home should be, number one, that all men sitting here, irrespective of Southeast Asian descent or not, have higher risk of developing heart disease. That risk is much higher in those who come from Southeast Asia, much higher, and is just recently being recognized, and even a lot of physicians may not know that. So they may tell you that your BMI, you mean your weight is fine, or your cholesterol is fine, and your sugar is fine. It may not be for you or for me because of my genetic makeup. So be very careful. Number two, please be careful of the diet. The food that we eat at home, when we go home and ask our wives to cook, if she cooks healthy, we get upset. don't do that. Try to eat healthy and cut the portions. Cut the portions. Instead of in this whole debate of what to eat, what not to eat, agar plate pe pahad bana hua hai, to usko kam kar dein. So cut the portions, that will help a lot. जब एक दफ़ा लेके दोबारा जाने का दिल कर रहा है तो ना जाएं खुदा के लिए. I think we need Ansarullah in the Jamaat and we don't want to lose them. So please decrease, especially what was said earlier, the pure sugars, juices, mithaiyan. Oh my God, mithai ko main mana nahi kar sakta, but cut it back significantly. Sugars are very, very, very harmful for us. So cut them. And third and second last is activity. Get up and move 150 minutes in a week, whichever way you want to get. When you're talking to someone on the phone, you're scrolling through, start walking around, park the car at a little distance, take the stairs, use the treadmill, walk around in your living room while you're watching TV. Whatever you want to do, move. At least 150 minutes. And lastly, don't smoke. Cigarette na piyein khuda ke liye. Sivaye zahar ke aur kuch nahi hai. It's a poison, no ifs, ands or buts. Do not smoke. Do not stand next to someone who's smoking. 10 minutes. If you stand 10 minutes next to a person who's smoking, you have smoked one cigarette. And it takes one cigarette to cause a heart attack. So be very careful. Jazakallah.
30 seconds and then this would be the
I'll just
conclusion.
add one point, that we are blessed to be Muslims. And now the modern science and recommendations are coming towards intermittent fasting. And what fasting has taught us, that the food that we consume most of the time is for social reasons or just for our tongue, basically. The body does not require the amount of food that we consume. And our body can live on very little amount of food. And that is something we should use. And for example, every Thursday, Hazrat Khalifatul Masih Ayyadullah Ta'ala bin Nasr al-Aziz has asked us to fast every Thursday. Use it for our health advantage in addition to spiritual advantage. Jazakallah.
Jazakallah. Thank you, Dr. Saab. Thank you, our panel, and all the very hot questions. Thank you again. If you have any questions, please come to the basement. These doctors, I can always arrange a consultation now or later. Jazakumullah again.
रोशनी का सफर